If you or someone you care about is living with COPD, that feeling of just not being able to catch your breath, it can be completely overwhelming, right? But what if I told you there's a proven program out there that can help you break free from that cycle, a way to actually regain control? Well, that's exactly what we're diving into today, pulmonary rehabilitation. It's this incredibly powerful, science-backed program designed to do just that.
Okay, so here's our game plan. First, we're going to really get into the challenge of COPD itself. Then, we'll look at that vicious cycle it creates and, more importantly, how rehab smashes it. We'll open up the toolkit you'll get, check out the hard evidence for why this works so well, and then, at the end, we'll lay out a super clear roadmap so you know exactly how to get started on this journey.
All right, so to really appreciate the solution, we've got to understand the problem first. What is actually happening inside your lungs when you have COPD? Well, think of it this way. It's a group of diseases that basically block the airflow, making a simple breath feel like you're trying to suck a thick milkshake through a tiny clogged straw.
And COPD really has two main culprits. First, you've got chronic bronchitis. This is where your airways get all inflamed and gunky with mucus, kind of like a rusty, clogged-up pipe. Then there's emphysema. This is where those tiny little air sacs in your lungs, the ones that are supposed to be springy like balloons, get damaged and lose their bounce. That makes it really, really hard to push old air out.
And all of that leads to this one core problem, what we call air trapping. Because the airways are narrow and the air sacs are floppy, that old, stale air just can't get out properly. It gets stuck. And when it's trapped in there, it takes up valuable real estate, leaving less and less room for the fresh, oxygen-rich air your body is desperate for. This, right here, is the very reason for that constant feeling of breathlessness.
And as you can imagine, that air trapping is what kicks off all these daily challenges. Your body tries to clear things out with a cough that just won't quit. Those narrow passages cause a wheezing sound, and it all adds up to that awful chest tightness and a shortness of breath that seems to make even the simplest tasks feel like climbing a mountain.
So this brings us to something absolutely crucial, what's known as the downward spiral. See, the symptoms of COPD, they don't just stay in the lungs. Nope, they can set off this really nasty, vicious cycle that affects your entire body.
And it all starts right here. When you feel short of breath, what's your first instinct? It's totally logical, right? You stop what you're doing, you start avoiding any activity that brings on that awful, uncomfortable feeling.
But, and this is a big but, that avoidance comes with a price. Over time, when you're not active, your body gets deconditioned. Your muscles, especially in your arms and legs, they start to get weaker and weaker.
And this is the real trap. Weaker muscles are just not as efficient. They need more oxygen to do the same amount of work. So what does that do? It puts an even bigger strain on your lungs, which are already working overtime. It's this cruel irony, right? The very thing you start doing to avoid feeling breathless, being less active, ends up making the breathlessness even worse. It's a classic vicious cycle.
But there is a way out, and that's what this is all about. Pulmonary rehab is, specifically, brilliantly designed to jump in and reverse this entire process. It's like the circuit breaker that stops that debilitating spiral right in its tracks.
So you're probably wondering, how on earth does it do that? How does it work? Well, let's open up the Rehab Toolkit and take a look at the actual practical things you learn in our program to take back control.
Okay, first up, and this is probably the most important technique you'll ever learn, pursed lip breathing. It's simple. You breathe in through your nose for a count of 2, then you pucker your lips like you're about to whistle, and breathe out slowly for a count of 4. So why does this magic work? That gentle pressure of breathing out slowly, it props your airways open just a little bit longer, and that gives more of that trapped, stale air a chance to finally escape.
Next is what we call belly breathing. You see, for a lot of folks with COPD, the little muscles in the neck and chest try to do all the work of breathing, and that is just exhausting. This technique retrains your diaphragm. That's the big, powerful muscle under your lungs that's designed for the job. By making it stronger, every single breath you take becomes more efficient and way, way less tiring.
And of course, exercise is the heart of the program. But listen, this is not about just being thrown into a gym. No way. It's a carefully designed program. You'll do aerobic training for your heart and lungs, strength training to rebuild those weak muscles we talked about, and flexibility work. But here's the key. It is all 100% tailored to your ability, and you're doing it with experts watching over you the whole time. And rehab is so much more than just the physical stuff. It's a full-on education. You finally learn how your medications really work, how to use your inhalers the right way. You'll literally create a personal action plan for when you have a bad day. You'll learn about nutrition, how to save your energy, and, this is a big one, how to manage the stress and anxiety that so often comes with a chronic illness.
Okay, so we've seen the what and the how, but the big question is, does it actually work? Well, let's look at the proof, the hard science, and the real-life stories that show just how incredibly effective pulmonary rehab is.
First off, this isn't some experimental fringe therapy. We are talking about a strong recommendation. That is the highest possible level of endorsement you can get from the world's top lung health organizations, like the American Thoracic Society and the big international group known as GOLD. These are the experts of the experts.
And the numbers, they speak for themselves. There's something called a Cochrane review, which is the gold standard for medical evidence, because it combines the results from tons of studies. This review looked at 65 different trials and found that people who finish rehab can walk, on average, almost 44 meters farther in a 6-minute test. Now, 44 meters might not sound like a marathon, but that's a huge, life-changing improvement. That's the difference between being stuck at the end of the grocery aisle and being able to finish your shopping. And it goes way beyond just physical ability. The impact on your overall well-being is just as profound. A stunning 62% of people in these studies reported a real, meaningful improvement in their quality of life. We're talking about feeling better, having more confidence, and getting back to doing the things that you actually love to do.
And this is where it all comes together with real people. This is Ron Smith. He was in a wheelchair, even on a lung transplant list. After going through pulmonary rehab, he got his independence back. And his message is just so powerful. It's your disease, you own it, don't let it own you. That right there is what this program is all about. It's about empowerment.
So if you're feeling a little bit inspired by all this, the science, the stories, you're probably thinking, okay, what's next? So let's walk through the final, most important part, the actual actionable steps to start your own journey. It really is the most important question, isn't it? You get the benefits, you've seen the proof, so how do you actually make it happen? How do you begin? You know, the process is actually way more straightforward than you might think. It all boils down to one simple action. You have to ask your doctor for a referral. You have to be your own biggest advocate here. Once you've done that, the rehab program staff, they usually take it from there. They'll handle the insurance stuff, they'll get you in for a one-on-one assessment to build your personal plan, and then you're ready for your first group session. It's that simple.
So, we've covered the what, the why, and the how. We've seen that pulmonary rehab is this proven, incredible path to breaking that awful cycle of breathlessness, to rebuilding your strength, and to truly reclaiming your life from COPD. So the only question that's really left is the one right here. What will your first step be?